Senator Smith, you're recognized for questions.
Thank you, Chair Lujan, and thank you to all of you for being here. I want to just note my good friend Senator Murkowski and I have worked a lot on rural health care issues together, so I appreciate your questions about that. And both of us have large areas of rural communities in our states, though I think Alaska trumps Minnesota in some ways on that. So I just want to thank you for your questions there. And I'm grateful for this hearing and the bipartisan spirit of this hearing. So I'd like to start by focusing on the mental health care workforce. Even before the pandemic, we knew that there was a growing need for mental health services, and the pandemic has, I think, shone a light on the deep need and made the need bigger. HRSA estimates that by 2025, we will need an additional 250,000 mental health professionals, from psychiatrists and mental health and substance use disorder specialists, school psychologists, school counselors. And of course, as Senator Murkowski is pointing out, rural communities are much more likely to have a shortage of mental health professionals, and people of color are much more likely to live in places where there is a shortage of mental health care. So today we're talking about the barriers that are facing people who want to get into this field, and one of them is money. This morning, I reintroduced my bipartisan bill, the Mental Health Professionals Workforce Shortage Loan Repayment Act. You do not need to remember the name, just remember the idea, with Senators Murkowski and Hassan. And what our bill would do is to provide student loan repayment for mental health professionals who want to practice in places where there are shortages. So, Dr. Herbert, if I could start with you, could you talk about the importance of loan repayment programs? You said how important it was that they were strategic in your opening remarks. I'd like to hear more about that, and tell us what you think we should have in our minds as we design and move these student loan repayment programs.
Well, thank you, Senator, for the question. Completely agree with you about the mental health crisis, and it's important that there's a number of things to say about this. First of all, we need to make sure that we train people in primary care who are not mental health specialists to do mental health first aid, to be able to, people in our schools, for example, teachers, to be able to recognize and be able to make appropriate referrals. So that's one piece that's there. In terms of loan repayment programs, these can work very, very well if they're done strategically. So just to give you one example, the chairman mentioned dentistry before, and we haven't talked a lot about that today. We have an incredible partnership with Delta Dental, Northeast Delta Dental, for loan repayment programs for dental graduates who decide to set up shop in underserved rural areas. Right. And we've been able to place, in the 5 years, 5 graduating classes of our new dental school, we've been able to place about 20 dentists in very, very remote rural communities that didn't have dentists before. So with regard to mental health, it's the exact same thing. We just need to make sure that we're targeting that there's a strong contingency where they need to practice in underserved areas, either rural or urban areas. And it's not just, I'm great about loan repayment programs in general, but to be maximally effective, they have to target underserved areas.
Yeah, exactly. And I appreciate your comment about training in primary care, because our brains and our bodies are connected. It's one person, one body, and we too often segment out our mental health care from our physical health care in ways that are not good for our overall health care. So thank you for that. Dr. Hildreth, I so appreciated your testimony, which I was able to hear before I went off to other committees, about the crucial role that historically Black medical schools play and the assets that you have when it comes to relationships and expertise and trust. And I wonder if you could just, and also, you very well pointed out the disparities that you experience in terms of the resources that you have available to build on your mission. So I wonder if you could talk a bit more about that, and maybe, I care a lot and have focused a lot on the great disparities in maternal health care, maternal morbidity, the disparities between Black women and white women, and how that kind of pans out as you think about the practices and the people that you work with.
Senator Smith, thank you for the question. And clearly, as we've alluded to earlier, when the provider can relate to the patient in terms of culture, race, and all of that, the outcomes are better. There are studies to show that Black women who are cared for by Black OBs have better outcomes, and their babies do as well. But it all comes back to what I said earlier. We are have been training healthcare professionals who are really competent and skilled, connected to their communities for decades. But our challenge is the infrastructure we have to do that. What we teach and how we teach it has changed dramatically. And majority institutions have been able to keep up with that change, but we don't have the resources, for example, to do small group teaching as opposed to sage on the stage. Standing in front of 100 students in a lecture hall is a great way to teach, but it's a terrible way to learn. So we need to change how we teach this. We like to do that at our institutions, but we don't have the resources to do it. So I would just submit again that if you gave us those resources, the payoff would be tremendous for the country. But thank you for the question.
Thank you very much. Thank you.